Dr. Ayurveda College Hospital, who delivered the keynote address. Thank you, Doctor, for inspiring us and encouraging us with your words on this day. I must thank Dr. Asha ST, HOD, Prasudi Department, who welcomed all, who is the backbone of this CME. I express my vote of thanks to Dr. Sanila, AKGA CAS President Kannur Unit, for accepting our invitation and for being here with us today. Students play an important role in improving and strengthening the society, and their presence in this event is more important. I am extending my gratitude to the student representatives, Dr. Sharavan, Secretary PGSA, Dr. Ansi, HSA representative, Mr. Shabin, College Union Chairman, for their presence in the event. I also thank the house surgeons who participated in this function. It's my privilege to express my gratitude to the teaching faculties of this college who attended the inaugural session. I express my heartfelt thanks to all the delegates who will make this event possible. It's my privilege to express my gratitude to all the resource persons who agreed to take classes and extend my thanks on behalf of Prasudi Department. Last but not least, I extend my gratitude to all my colleagues who worked hard in hosting the event. Once again, thanking each one and all of you. Thank you all.
You. The inaugural session is over. Moving on to the sessions of JEEVADA. Our first session is based on the prime topic, Garbha Samskaras. The paper in this session will be presented to you by Dr. Rajagopal Krishnan. Dr. Rajagopal Krishnan completed his bachelor degree in Ayurveda from Vaidyaratnam P.S. Vaidya Ayurveda College, Kottayam. With an extensive knowledge, Dr. Rajagopal is well versed in the field of Ayurvedic oncology, and he has served as a resource person at National Institute of Cancer Prevention and Research, Noida. He has also been honored as Oncology Resource Person at All India Institute of Ayurveda, New Delhi. Currently, he works as Chief Physician at SKBA Pharmacy, the Ayurveda Oncology and Immunology Research Center, Kollam. We wholeheartedly welcome you, sir, to present the paper.
Thank you, everybody. Hope you can hear me, right?
Yes, sir.
Can you guys hear me?
Yes, sir.
Okay, let's start. Like all, I say my gratitude to all the teachers and all the faculties that has attended the inaugural session, and I welcome all the delegates too. So we are here to talk about Garbha Samskaras, why Garbha Samskaras are so important, and why the preparation of a human body to conception is so much relevant in these times. I'll start with one of the clinical observation that you may see on a daily basis. Like young children, once a patient came to me, a mother and daughter. Daughter was like 7 years old. And mother said, my daughter started having periods. She was starting her periods or menarche at 7 years old. This is very, very unusual, but you can see it's so very common now that our children are getting menarche by the age of 6, 7, 8. Similarly, you see when our grandmothers, etc., they had menopause around 55, 60 years of age. But now you see women getting menopause by the early age of 40, 45 years. So why is this happening? Why are women getting menarche earlier and getting an early menopause? Why this culture, there's a cultural shift in this particular matter. We'll see about why ovaries are the most age-sensitive organs in the body. They are so very sensitive to food, to stress, to diet, to your mental and physiological sleep, everything. But because of the high fast food culture, bad diet, lack of exercise, your ovaries are aging faster. So where a 7-year-old kid, due to increased amount of fast food and sugars and other cool drinks, her ovaries age faster. So at 7 years old, a ovary becomes 10, 12 years old. As a result, ovary starts to bleed. So when our women are aging faster, they start to develop age-related diseases even more faster. See, why Ritucharya or Ritumaticharya or Garbha Samskaras are so relevant or relevant in these years is, let us see first the most controversial one. Before I start Ritumaticharya, let me, since there is time restriction, time constriction, we'll start why Pumsavana. You all know Pumsavana, right? So for me, when I read Pumsavana, there is a what is a gender morality to that by desiring a male child, right? Is it good or is it right to do Pumsavana so that you get a male child? So what is the scientific basis of Pumsavana? See, avyakte prathame mase, saptahat kalalam bhavet, right? You know, in the first 7 days, the garbha is formed as a kalala. And garbham pumsamanam anyatra purvam vyakte prayojayet. Before the fetus undergoes sex determination, pumsavana has to be done. And how is it done? Bali Purishagarohi Devam Apyadivartade. There are two factors that affect the sex of a child. One is Ihaloka Karma, Bali Purishagaro, and other is Daivam Apyadivartade. That is Purva Janmakrita Karma. And Vagbada clearly says your Ihaloka Karma, that is your diet, habits, your sleep, and stress are the number one determining factors for fetal development or fetal sex determination. Is this true? See, males have a XY chromosome and females have a XX chromosomes, right? So a male sperm has X sperm and Y sperm, and a female has a ova, which is X. By natural process, there is a paper or research done in University of Granada under Dr. Maria Isabel. What she did is, what they did, there were a group of doctors, they studied the effect of stress on sex determination. So how stress determines which child is born. So what they did is, they took the hair, saliva of the female before, during, and after conception. Once the semen is ejaculated into the vagina, the semen can stay in the vagina for up to 5 days. Up to 5 days, it can impregnate a woman. So don't think the time of conception is the time of ejaculation. No. After the time of ejaculation, the sperm can survive in the uterus for up to 5 to 6 days. So in 5 to 6 days, there is a chance of conception. And Pumsavana has to be done before this time period is initiated. So what Dr. Maria and her colleagues did is, they studied the cortisol level in the hair and saliva of women before, during, and after conception, as well as they did psychological stress test. And what they found out was that it is very, very astonishing. Increased stress or increased cortisol level in blood whenever a female is having increased financial, social, or any kind of stress, when her cortisol level is higher in blood or in saliva, what they found out was that a chance of a female child conception is double. That is, evolution favors the female child. Why is this happening? See, when the female body is in stress, severe physiological, psychological, or mental stress, the body doesn't know that if you are having nuclear winter or you are in war or anything. Darwin, survival of the fittest. So for the survival of the species, evolution always favors a female child, because one man can impregnate millions of women, but you need hundreds and hundreds of women so that the human race or a particular genetic race can survive the hardships. So whenever your body is in stress, your cortisol level is high, a female child is always favored. Let me tell you a story. See, I come from a very traditional Ayurveda family. We have been doing Ayurveda for the past like 1,000 years. So my grandmother, like usually the first born male child is usually taught Ayurveda. So my grandmother was in a huge amount of stress in the family to deliver a male child. And because of this huge stress, she got pregnant and she delivered a female child. That was the first child. Then after the delivery of the first female child, she was again put under severe stress to deliver a male child. But again, it was a female child. Second, third was a female child. Fourth was a female child. And finally, when she was taken out of this home and kept in another home, the fifth pregnancy was a male child. That was my father. See, this is the case everywhere. Whenever the female body is in severe stress or when the cortisol is high, by evolution, the X chromosome is favored over the Y chromosome. And why is this? Whenever the female body is in stress, we checked how X sperms and Y sperms survive in the vagina. What we have seen is the X sperms have higher compatibility or higher survival rate in the vagina, in the uterus, than the Y sperm. And X sperm has more chance of surviving when the cortisol level in a female body is high. Not only that, whenever the female body is under high cortisol, physiological or financial or sociological stress, one particular thing that happens is the X chromosome or the Y, whenever the Y sperm ovulates or undergoes fertilization with the ovum, there is a higher chance of abortion. That was also done in the University of Granada, where they checked whenever female patients or females were under stress with increased cortisol, the number of abortions they had were increased, and all the abortions had a higher percentage of male fetuses. The chance of male child dying is very, very high whenever there is a stress, physiological, sociological stress in the human body. So please understand that by nature, by evolution, a female child is always favored. And in India, especially with the increased amount of financial and social stress, a mother's body is always under severe stress in different forms by the food and diet they eat, especially the fast foods the females eat today. The worst kind of addicts are females. You think men are like alcoholics and cigarette smokers. Actually, if you take the total amount of deaths or diseases in human body, 80% of all deaths in the human world is caused by food and environment. Alcohol, drugs cause about 15 to 20% of deaths and abnormalities. And females are extremely addicted to food. You can see that. You see a female, whenever a period is happening or when she is going to have period, she will have cravings. And nowadays, what they do is they go eat the burger, the pizzas, and all that fast food shit. And then they will be having apana vayu vaigunya with nivrittamane apanohi tairatho marga rodhada shobayan anilan anyan sarvendriya shariragan. Udavarta samprapti initiated, and there is vada vilomada instead of apana vayu anilomada, which is supposed to happen during periods. The female body, because of the intake of fast foods, high amount of sugars, and high amount of bad saturated fats and hydrogenated fats, develop inflammatory bowel, develops apana vayu rodha, as a result, she will start developing different period problems and different thyroiditis and other autoimmune diseases. So, whenever you see cortisol level is high, the female child is favored by evolution. So, that to double, twice is how much that a female child is favored when a female human body is under stress or with the increased rise of cortisol. So just imagine, we need a proper 50-50 ratio for the sex ratio to be correct, right? When our females are continuously taking fast food, they are not exercising, they are put under financial and social strain, what will happen is evolution will favor a female child more. That is why Pumsavana is very, very important. See, when you are doing Pumsavana, you see that what is the next step or the research that you can do in Pumsavana is, when you take the Pumsavana drugs or the different karmas, you see Nasya is a very, very important thing in Pumsavana. See, Lakshmana Mula paste with milk, Nasya or Pana, Shweta Prakriti Mula with paste or Pana. Why Nasya is such an important part of Pumsavana is, Nasya has a very high level or very high action against stress relief or cortisol reduction. So when you do Nasya with different kinds of Ayurveda drugs, one of the solutions that you can have for Pumsavana is, if our Nasya or Pumsavana Charya is reducing the cortisol level in the female body, it actually brings down the female sex ratio to more towards 50-50 ratio towards the male end, which is not actually not favoring the male child. It is actually equalizing Darwinism or equalizing the survival of the male child more, because already the female child is favored 2x because of the stress in the female body. So when a female child is favored 2x, a male child is only 1x. By doing Pumsavana, what we are hoping that to achieve is, even not only Pumsavana, even Garbhadana Karma or Garbhini Charya or any kind of Ayurveda Charya you see is aimed at reducing the stress in the female body, both mental stress as well as physical stress. So, and when you see the Pumsavana Karma, you see the importance of Nasya, and Nasya is known to reduce blood cortisol level as well as stress levels by a long way other than eternal medications. So when you give Lakshmana Mula is Madhura Shida Virya, Madhura Rasa Shida Virya, and when you are doing Nasya with Madhura Rasa Shida Virya, obviously we are hoping that the amount of cortisol level in the human body is reduced. So by the reduction of this cortisol level, there is a more chance for the Y sperm to actually impregnate or fertilize the egg as compared to the X sperm. So when you do Pumsavana Charya or Garbhini Charya and the cortisol level goes down, the chance of a Y chromosome or a Y sperm fertilizing the egg increases. And whenever the stress level or cortisol level is decreased, the chance of abortion drastically reduces. Drastically reduces, like if normally without doing Pumsavana at a high cortisol level, the chance of a male child getting aborted is 2x that is compared to a female child getting aborted. So there is an imbalance. There is an imbalance in nature. Imbalance in nature, especially when our females are tortured mentally, physically, or socially. They have an increased cortisol level rise. As a result, a female child is favored by evolution. So when you are doing Pumsavana Karma, Pushye Purushagam, Haimam, Rajadam, so Kritva Agni Varnam, Nirvapya Kshiram, Tasya Anjalim Pibet. or when you are doing Lakshmana Mula paste with milk, or Shweta Burkhati Mula with paste with milk as Nasya, what we are hoping to do is actually reduce the cortisol level in the females so that evolution can have a more 50-50 chance of conception of the male child, and not only have a chance 50-50 chance of male and female child, not only that, but reduce the rate of abortion. Also, you know, the increased stress, female stress, is in par with the amount of childhood diseases. I treat cancer, I treat immunology cases. So what I have seen is the number of cancers, leukemia, childhood leukemia, Ewing's sarcoma, autistic children are in a rise. Why are these disorders in a rise? It is true that we have been able to reduce the death rate in children, but the amount of natural deformities, neurological deformities that are born, children with defects, are very, very high. This is due, main cause is due to the food and habits of our females. Females are food addicts, basically. So when you are addicted to food, you are continuously taking the pizzas, burgers, high intake of sugar, carbohydrates, high intake of gluten, high intake of saturated fats. Your body is always inflamed. As a result, you get DNA damage. Where is DNA damage happening? As I said, ovaries are the most age-sensitive organs in your body. So when you are eating a parota and beef, or when you are eating a pizza, it goes into your stomach. It doesn't get digested properly. It causes inflammatory reactions in your gut. And from this gut, you see the inflammatory biomarkers leaking into the blood and reaching the thyroids or the pancreas or the ovaries. And this reaction or autoimmune reaction in your ovaries causes a immune shift or DNA damage in your ovaries. As a result, you will get more DNA damages in your ovary. This increased DNA damage in the ovary is called premature aging. You start to age faster than you are supposed to. This premature aging of the ovaries is number one cause for developmental disorders that are seen in children as well as young adults. So when we are trying to create a less stress, less cortisol female body. Similarly with the male. See, when you are seeing the Garbhadana Samskara, you will see that during Garbhadana Samskara, the male is, or the male person is said to eat what? Sarpik, Shira, and Shalyodhanam. He is supposed to do Brahmana Karma, whereas females are Karsidangi, is Langhana Karma with Taila Mashahara. Why is a female advised to do Karsidanga and a male advised to do Brahmana? Same you can see when you are taking Ritumati Charya. Brahmacharini, Snana Alangara Rehida, Dharbasayanam, Yavagam Payasaha, Karsana Dasniyat. When you are in periods or when you are having periods, it is advised to eat less but nutritious food. Karsana Dasniyat, and avoid Tikshna, Ushna, Amla, Levana, Javarjayet. Do not eat foodstuffs that are Tikshna, Ushna, Amla, and Levana. And why is this advised? The same advice you can see for the females before pregnancy or before periods. She is advised to eat tilamasha and tilamashadi, which is more pittala, which is more srodo shodhana, which is more apana vayu anulomana, so that the proper artava is formed properly and it is discharged properly. See, the most important thing you need to understand is the female body is completely different from that of a male body. That is what I talk to or teach my students when I come. You treat a male as another, creature, and female as another creature. See, this is very relevant from the fact that when you see the death rates of COVID, the infection death rates of COVID, you will see that number of death rates in male due to COVID is way higher than that of females. Why is this? The females have, as I said, XX chromosome and males have XY chromosome. X chromosome is responsible for your immune system. So females have two X chromosomes, so they have a better immune system to fight against diseases and other microbes. But the same two X chromosomes in the female also acts as a double-edged sword. When you are a food addict, when you are not exercising, when you are basically eating yourself to death, what happens is females develop autoimmune reactions and aging faster than males. That you can see, like after 30 you see a female, she'll start putting up weight so much, she'll be eating the same food, she'll be graying faster, she'll be by 40-45 she'll be having menopause. Because of the two X chromosomes, their immune system becomes hyperactive, and hyperactive immune system along with the socio-physical stress causes the female body into an autoimmune state faster than a male body. As a result, Acharya says, before you are conception, if you are planning on conception, the female should have Srodoshodhana, Artava Shuddhi, and Apana Vayu, Anulomana Ahara, which is Karshanada, which is a bit, Lankhana, which actually reduces her fat and glucose amount, whereas a male is advised for Shira Sarpi and Salyodhanam. The thing reverses once you enter into pregnancy. Once you enter into pregnancy, Acharya particularly says that the Garbhini should be taking Swadu Sida Drava Prayam, Satmyam Aharam, Swadu Sida Drava Prayam, not Amla Ushna Tishna. Amla Ushna Tishna should not be taken during Ritucharya or during pregnancy. Before conception, the intake of foods that should be Tilamashadi for Srodoshodhana, and after conception, the female should take Swadu Sida Drava Prayam, Satmyam Cha Aharam, and 2 times Sayam Pradira Ahare. See, for Garbhini also or for a Ritumati, the number of times of feeding per day is only 2. See, we are feeding our Garbhinis like 5 to 6 times a day. And what happens when you are feeding or overfeeding your Garbhini is Madhira Nityam Pramehinam Muga Adistulamba. See, when you are naturally a female requires around 1,800 to 2,000 calories. A Garbhini requires 300 calories more, just 300 calories more, but more nutrient beneficial, like the veggies, lots of green leafy vegetables, fruits, nuts, oils. Oils are very, very important for Garbhini. And for in Ritugala, for Ritu Shodhana, Acharya advises Tailam Asha Ahara as well as Darbha Shayana during Ritumati Charya. Whereas for the male, it is Masam Brahmacharini. See, why a male is advised for Masam Brahmachari? See, when you are not having or when you are not ejaculating, one of the most important factor for increased virility of the sperm is the testosterone level of the male, as well as testosterone and cortisol level of the female. The male require a high testosterone level to produce good quality sperms. So that is why Aharam Nidra Brahmacharyam. When you are continuously ejaculating, when you are continuously masturbating or continuously ejaculating, what happens is the natural testosterone in the body reduces. You can see that a 7 day, if you are not ejaculating or if you are not ejaculating your sperm for 7 days, by the 7th day, your testosterone level becomes 1.5x or 2x. It nearly doubles. So what I do is when I do sports, and if especially you see like people's like high-end sports people, Virat Kohli's or the Federers or Nadal's, they do not ejaculate for 1 to 2 weeks before a tournament, because they will have peak testosterone after 1 to 2 weeks. When they are peaking testosterone, they will have more virility, they will have more perseverance, they will have more sahana, so that they can perform with more mental clarity and physical strength. The same is needed for conception. The man should be brahmachari for like 7 to 30 days, so that he peaks his testosterone level at the highest at the time of ejaculation. Similarly, for a female, it is also advised to be Tilamasha Ahara, Kashidangi, as well as Brahmacharini. In Ridhumati Charya, you will see Snana Alangara Rehita or Dharba Sayana, Snana Alangara Rehita. You ask me why the during menstruation, you are not supposed to bath or you are not supposed to do certain things. Two things I will say. If you are having menstrual period, you need to avoid two things. One is extreme hot water and extreme cold water, because cold water causes stambana and hot water causes increased flow. See, you need to understand, a female body undergoes shodhana every month. See, when you see the Pancha Shodhanas, Raktamoksha is a Prathana Pancha Shodhana. So a female body undergoes Rakta Moksha every month. What happens when you are Rakta Moksha every month is, where is this Rakta formed from? See, Rakta is formed from as you know, Rasad Raktam Tado Mamsam, according to Ayurveda. And in the human body, when you see the bone marrow, there are cells called hematopoietic stem cells. These are the stem cells that produce your WBC, RBC, and platelets. The most amount of stem cells are cells which can be transformed into any tissue. They can transform into blood, they can transform into lungs, they can transform into anything. And the stem cell level is absolutely crucial for body repair, as well as reducing autoimmune diseases, as well as improving fertility and virility. So when you are undergoing Shodhana or during Ritukala, your blood is lost. What happens as a normal mechanism? After Shodhana, your hematopoietic stem cells in your bone marrow starts producing more WBCs, RBCs, and platelets. So whenever after Raktamoksha or after periods, you will see an increased amount of stem cell activation in your bone marrow. So during this time, nutrition and feeding habits are very, very important, because if you are giving bad food during Ritucharya or during Garbha Samskara, what happens is, what you eat, every molecule you eat is converted into these stem cells and body tissues. So if you are eating burger and parota, what will happen is, these burger and parota gets dissipated, and the inflammatory gluten, sugar, etc. will flood your blood, and the fetus that is formed, or the ova that is formed, or the blood that is formed is made up of tissue that is or bad. So bad food equals bad baby. Bad food equals bad Ritu Shodhana. That is why always, before and after periods, be very careful with what you eat. Do not eat fast food junk before and after periods. Actually avoid gluten containing foods. Chapati, parota, or the fried snacks, the pizzas, the lays, the butter, etc. And after when you have done Shodhana or Rudacharya, after that you do a Samsana karma, like you do a Payadi, like you do Payadi after Shodhana. After Rudacharya, make sure that you start with very nutritious Paya, and slowly as the digestive fire increases, improve your food intake as well. And also one more thing is, you will see that during when to give milk during Ritucharya as well as as a Garbha Samskara is always a double-edged sword. Please understand that I have seen so many Ayurveda practitioners blindly giving milk to Garbhinis and children, as well as for before and after conception. Do not give there are two kinds of milk actually, A1 milk and A2 milk. A1 milk is made from the hybrid cows, which is called the Jersey, etc., and A2 milk from the indigenous variety. A1 variety cow or A1 casein protein is very bad for the human body, and A2 casein protein is more tolerated in the human body, and it doesn't cause an autoimmune reaction. And you can see the amount of milk that should be given. When you Ashtangridya says Agnivarmam Nirvapyam Kshire Tasya Anjalim Pibet. See, during Pumsavana Karma, the amount of milk that should be given is only 1 Anjali. 1 Anjali is around 75 ml of milk. Do not give 1 tumbler of milk 2 times daily. No. And please understand that the Garbhini or during Garbha Samskara or before and after, the Pishtana should be avoided. What is Pishtana? Pishtana is grounded flour or any kind of food that is made from refined flour. Dosa, idli, puttu, all these are called Pishtana, made from refined flour. Why is this not advised for a Garbhini? See, you will see that most of our children or most of our females are pre-diabetic during pregnancy. Pre-diabetic during pregnancy because they have a bad insulin resistance in their body because they are already eating bad junk as well as bad nutrients and they are not exercising. So if you are overfeeding, what happens is they will develop insulin resistance. When they develop insulin resistance, it badly affects the child as well. That is why you will see most of the pregnant women, after they give birth, after some time, they will become chronic diabetes. When you are taking pishtana or grounded flour, rotis, chapatis, the dosa, idli, what is happening is, let me explain to you in a small package. You take 1 cup of refined rice powder, 1 cup of rice, both having the same weight. So with 1 cup of rice flour, you can make maximum half kuti of puttu or 1 or 2 idlis. That is the most amount you can make with a cup of rice flour. But when you take the same amount, same gram of rice and you boil it in a cooker, the rice will be for 4 people. Actually, 4 people can feed on the rice. So when you are taking half kuti puttu or 2 idlis, you are actually taking the calorie intake of 4 to 5 people. The glucose spike when you eat pishtana. That is why Charaga particularly mentions pishtana should not be taken daily. Pishtana should not be taken regularly. If you are taking pishtana, take very little pishtana with lots of snigdhata, with ghee or coconut oil, etc. So if you are, and please see that during Garbha Samskara it is said, Swad Shida Dreva Prayam. Food should be more Dreva Prayam, not Ruksha. Pishtana is Ruksha, and eating of pishtana causes glucose spike in the Garbhini as well as before and during conception. Even during Ritukala, do not take pishtana because pishtana will cause apana vayu rodha because of its rukshada and gurutvam. That is why all our Garbhinis are having pre-diabetic symptoms. They will start the day with a glass of milk, then they will be eating pishtana, idli, dosa, etc. 11 o'clock, they will be given another snack. 1 o'clock, they will be given lunch with lots of things, mamsahara or fish or other things. Then 4 o'clock, they will be again given milk or chai. Then evening, they will be fed with dinner, again pishtana with chapati or naan or roti or etc. And again, they will be given a glass of milk. See, this is around 3,500 calories of unwanted food. When you are one of the most important thing when during Garbha Samskara, you have to note is, Acharya always says, avoid ama for a ritu Madi as well as for during Garbhasrava. Because why? Garbhasrava related to Ama Ajirna is very, very difficult to treat. Similarly, when you are having Ama Ajirna during Ritukala, it is very, very difficult to treat because Ama Ajirna Chikilsa is Dibana Pajana. But you are having increased Garbhasrava or flow so that we cannot do Tikshna or Ushna Chikilsa. There we have to do Stambhana, but Stambhana is Ama Virodha. So always be sure and always be particular of the fact that you should not be using Guru Ajirna Amahara for during Ritukala and for Garbhini. As well as please see the amount of milk that should be given. In the 8th month, you will see Charaga and Ashtanga Sangraha says giving milk, palkashayas or different types of milks are given. Milk with ghee, milk with navanita, milk with honey for subsequent months it's said. And in the 8th month, Kshira Yavagu is said. So Kshira Yavagu, when Atreya says Kshira Yavagu is good, then Gaiditya or Bhadrakapya says, how come Atreya, if you are giving Kshira, so much Kshira to the Garbhini, the child will develop Paingalya. Paingalya is a Pitta Vigridi. See, Krida Ala. Kshira is actually Swadu Pitta Shamana, but it causes Pitta Vigridi or inflammatory reactions in the body, causing ama and can cause Pitta Vigridi in children. The Pandutva or Paingalya or Rektapitta or Gulma, etc. in the fetus. That is why the amount of Kshira should be regulated. Acharya always says 1 Anjali is the maximum amount of milk at a time. 1 Anjali is 75 ml milk. 75 ml diluted to 2 or 3 times with water can be given. Make sure the Garbhini or Ritukala during Ritukala or the person is not lactose intolerant. Make sure that he or she doesn't have a gastric issue with milk. Make sure that you do allergy test or a dairy allergy test before you prescribe any palkashaya or any kind of milk in a Garbhini diet. Why is Garbhini or Ritukala after conception? During Pumsavana also, Acharya says like Agni Varnam Nirvapyam Shire Tasya Anjalim Pipet. 1 Anjali of milk that should be dipped in gold, silver or ISS should be given. Only 1 Anjali. More than that is not required. Especially in our modern diet where they are getting proteins from Mamsahara. They'll be taking fish. They'll be taking lots of other aharas like chicken or dairy products, paneer, etc. Do not add more of milk proteins to that, because the Garbhini or during Ritukala, the chance of ama is very, very high. Always be careful while giving milk to a Garbhini. Please, I always see Ayurveda doctors blindly prescribing milk. Milk is not to be something that to be given blindly. That is why Kaidarya Bhadragapya particularly says of Pitta Vigridi Paingalya during 8th month. And in the 9th month, there is said that it is not Kshire Yavagu, it is Snigdha Yavagu. Yavagu should be given with fats, not with milk. Please understand, if you are giving milk to a Garbhini and if she has lactose intolerance, it will harmfully affect the baby. You will see the baby is getting amniotic fluid dip. There might be amniotic fluid dip happening. There might be fluid problems happening. There might be other Vikriti or Garbha Vikriti happening if you are giving lots of milk to the Garbhini. So be careful with that. Another thing I would like to keep in notice is, morning, always during Ritukala or during Garbhini time, always take Yavagu or Peya, which is Snigdha. Add ghee, a small cup of Yavagu with lots of ghee or lots of coconut oil with coconut milk, not Kshira. Use coconut milk. Coconut milk is much more safer than using Kshira, because there was a study in 2018 done by the Indian government to see the amount of antibiotics in milk. In commercial milk, the amount of antibiotics is so high, and in India, our Milma, had the highest amount of antibiotics in it. So when you are giving antibiotic-rich milk to a Garbhini, what happens is her gut biodata dies off, the child's gut biodata dies off, and it causes even more problems. And the last thing I would like to say is, I think time is up. I'm not taking too much time here. So, and the last thing that you have to be careful while doing Garbhadana Karma or during Ritucharya is your mental, psychological stress. See, if you want to have a good, healthy baby, it is very, very important that you reduce the female stress. That is why in all our samhitas, Garbha Avadagara Bhavas, different types of things that has to be avoided by the Garbhini, Pishtanam, Lakutishnaanam, increased exercise, Vyavayam, all these should be avoided by during Ritukala as well as during Garbhini Charya. It is very, very important. And please understand, even though a Garbhini is said to be fed, always feed the Garbhini with Drava Yavagu or Peya, not Pishtana. If you are feeding Garbhini or during Ritukala with Pishtana, Ama Ajirna can happen, Udavarta Samprapti can happen, Garbhasrava can happen. So always be careful. During Ritucharya, during your periods, treat your body as if you are doing a Panchashodhana. So before, you should be eating Snigdahara, Lekhu Ahara during the Ritu, and after Ritu, you take Peyadi for 1 or 2 days. This continuous cycle, just by doing this, just by doing a proper Shodhana every month, Shodhana Karma every month, you will start reducing your biological age, you will have better periods, you will have better hormones, you will reduce your weight, everything happens. So be very careful with all the things that I have said. And I hope we can, what do you say, and also in Pumsavan, I have said like Anjali Pramana is the milk, you know. That is because in olden times, there is no other source of protein. Most of them were vegetarians, and milk was the only source of protein. And these were indigenous cows. But it's not the case now. We have lots of sources of protein now, and most of the females are now lactose intolerant. So be careful with that also. And one more thing I would like to say is about the folic acid used during and before pregnancy. Do not use folic acid supplements or iron supplements before and after conception. It is very, very bad for you. There is a 44% of the women, if you take 100 women, 44 women that don't have a particular gene mutation called MTHFR gene mutation. So what is MTHFR gene is? Once a female is having this MTHFR gene mutation, they cannot, synthesize folic acid. So when you are giving folic acid supply without testing the MTHFR gene, what you are supposedly doing is giving mega doses of folic acid to a person who cannot actually absorb or process folic acid. So what happens here? When this process is continuously going on, the increased folic acid amount actually becomes toxic in the blood. And this toxic levels of folic acid is the #1 cause of postpartum depression in females. Just by giving folic acid supplements during pregnancy and before pregnancy, you are actually causing danger to the baby, you are causing danger to the mother, as well as you are forcing her to become postpartum depression. So do not give folic acid supplement, because in 144 women are MTHFR mutation, and if you are giving folic acid, they will go nuts, they will become depressed, they will become anxious, and they'll develop autoimmune reaction to this folic acid. So these are the things that should be kept in mind during practice, and hopefully your feeding habits, your brahmacharya habits, and your reduced physical stress will help improve your fertility, virility, as well as garbhadana. Thank you.
Thank you, sir. Now it's time for discussion. Dear delegates, can raise your doubts and put forward your valuable suggestions regarding the same.
So how to assess whether folic acid as a normal core should not be given to a garbhini? Because if you need to get natural iron, see, what is folic acid? When you see an iron supplement, it is basically derived from iron ore, and this iron ore is changed into folic acid, etc. You give the garbhini iron containing foods, pomegranates or dates or a little bit of what do you say, green leafy vegetables, curry leaves, etc. All that are rich in iron. Give the Garbhini enough of food supplements instead of folic acid supplements. As in South India, everyone is Satmya with Pishtana. If we change that too. Please, can you just repeat that question? If See, the thing about Pishtana is you think you are Satmya with Pishtana. You can never be Satmya with Pishtana because Ayurveda constantly says Pishtana is bad for you because of its high glycemic index. It will cause glucose spike and it will cause increased, what do you say, insulin resistance as well as insulin bad glucose metabolism, bad fat metabolism. So pishtana should never be eaten daily. You can have a dosha or masala dosha once or twice in a week, but not daily. You will die faster.
Hope no other queries are there. Now, I invite Dr. Vijita PK, Assistant Professor, Department of Prasuti Tantra and Stri Roga, to thank Dr. Gopal Krishnan for this fruitful and interactive session.
Am I audible?
Yeah.
I'm very happy to give a small thanks note to Dr. Rajgopal. That was a really informative session from Dr. Rajgopal. There were many new insights towards different aspects of preconceptional and antenatal care from Dr. Rajgopal. Thanks for sharing your views, sir. And beyond all these things, in person, I'm so excited or happy to hear from you because he's my dear senior and I'm hearing after years. On sharing the different aspects and different views, pointing towards many new different research papers, was really interesting for us, for all the audience. We have more queries regarding the session. We'll share it, we'll answer to these sessions after sharing it with Dr. Rajgopal. Anyway, I'm once again giving a lot of thanks to Dr. Rajgopal for such a wonderful session. Thank you.
Thank you, Praji. She's my dear junior. You know, I always say there are no bad juniors, there are only bad seniors. There are no bad children, there are only bad parents. Have a great day. Thank you.
Thank you. Moving on to the second session on JEEVADA 2024. The next paper in JEEVADA 2024 is on effective Aushadha Yogas in prenatal care. This session will be handled by Dr. M.A. Asmabi, Medical Officer, Government Ayurveda Dispensary, Manarkad, Palakkad. Dr. Asmabi completed her bachelor degree in Ayurveda, post-graduation in Prasuti Tantra and Stri Roga from Government Ayurveda College, Thiruvananthapuram. She is equipped with more than 10 years of experience in government service and clinical practice in gynecology and infertility. She has also chaired as a resource person in various national and international level seminars and conducted numerous public awareness classes. Dr. Asmabi worked as the state convener of Ritu Project, a program on adolescent school health. She holds the Bishop Pratibha Award by Ayurveda Medical Association of India. She had written many articles in various magazines like Physician, Apta, Treatise, Info Doctors Ayurveda, and other social media platforms. We welcome you, ma'am, for the presentation.
Thank you. Am I audible?
Yes,
Sound is
ma'am.
clear?
Yes, yes.
Okay. First of all, I would like to express my sincere gratitude towards the organizers of this program, especially our teacher and senior, Dr. Asha ST ma'am, Prajita doctor, Shiny teacher, and all present, all gathered here. Here, this topic. First of all, let me appreciate to conducting this type of seminars, including in offline and also in online sessions, because from different parts we can collectively we can participate in this program and we can present these papers, and there are so many opportunities by doing these online sessions. So the topic given me is the effective yoga formulations in antenatal care. Next slide. Can you put in slideshow?
We are trying, ma'am. There is some
It's okay, no
technical issue.
problem. Then you may take the
We'll
next
try.
slide. So this
You may
Garbhadi
proceed.
Paricharya itself, there are so many different topics, including in these two-day seminars, today and tomorrow. Here the topic given to me is the effective Aushadha yogas. Here the Garbhadi itself for antenatal care. Here the Garbha Asti Isya and Paricharya means care in all aspects. Next slide. How we can care the Garbhini? We know itself. Purnamiva Taila Patra Vasam Chobayet Andarpatni Bhavatupacharya. So whatever the means we have to take care without having shaking the pouch, that time we have to protect the Garbhini. Next, the component of the Garbhadi Paricharya, which includes these Ahara, Vihara and Aushadha. Next. So coming to this Ahara Rasa, here this nourishment of her own body, nourishment of the fetus, and the nourishment of the breast milk, or otherwise the breast milk production. Next slide. Then coming to Ahara, I'm not more concentrating here, but even though it should be palatable, Laghu, including this Brahmana, like Shashtika, Laghu, like Lajapeya, then Kshira and Mamsarasa is also included in this Ahara Rasa. Then Ushnodaga is considered according to Desha, Kala, Agni, and Matra. This Ahara should be administered to the Garbhini. Next. So the as per different acharyas, what I am coordinating here all this, but even though from the first trimester itself, there are conditions on how to take this Garbhadi Paricharya or whatever the food we can take are to be very clearly, it should be mentioned. Some examples like Shali, Shashtika, from starting itself, Navanida should be from the starting of the pregnancy itself, butter, ghee, milk, then green gram, wheat, etc. So different type of ahara which are to be mentioned from the first trimester itself. Next. Here coming to Aushadha, this is my topic. Here, there are so many doubts are coming in our OP. And whenever a patient or like Garbhini is coming, there are so many doubts maybe there. Any type of food they can take, or any regarding their travel, regarding their food or water, everything that may be doubtful, because is it possible to take? Nowadays there is so many effective to the social medias itself, because some patients will tell, and they not alone this antenatal in the aspect of antenatal care, but in regular practice itself they will ask that. In today itself one patient asked me that there are so many pain, some different parts of my body. One YouTube they will tell that it is like fibromyalgia. The diagnosis of my case is fibromyalgia. There may be different. The social media is having so many effect. So that's why we should answer their queries. It should be our responsibility in such conditions. So here the Aushadha, it should be Vyadin Shasya Mridhu Sukhair Atechne Aushadir Jayed. Whatever the medicines we are selecting, it should be Mridhu Atechna Aushadha should be administered. Next. Usually we are categorized these whatever the in practical aspect from the first trimester, what are the medicines we have to give, and on the second trimester and on the third trimester. As per the modern itself, we know that parallelly this antenatal care will go on, like whatever the medicines they are take, like TT dose of injections and everything. Their proper antenatal care, the modern side, it will go on, and parallelly. In most of the conditions, parallelly we are giving the means antenatal care to the Garbhini, especially in the practice of Kerala itself. Here, the first trimester, we can consider some medicines like Bala Siddham Baiha. Bala itself is from all trimester or all months. Bala is to be suitable for that. Then Laja, Danyega, with honey or muhur it can be taken for if there is any nausea or vomiting. Not I'm going to the complete elements of the pregnancy because that will come in another topic. But here, just I'm going to describe some common medicines or common conditions and the common medicines we can take to the Garbhini. Then Laja Artraga itself, if there is nausea or vomiting, if there any distaste or like that, Laja Artraga, combination of the Laja and Artraga, it would be beneficial to getting the proper digestive strength and also for the nourishment. Then regarding Mahadanandara Gulika, there will be so many controversies regarding Mahadanandara Gulika. Here it is not is indicated or it is contraindicated. There are so many doubts and discussions are going on nowadays itself. But from that discussions, I noticed so many pregnant ladies after taking this Mahadanandara Gulika, actually there is no harm to that conditions or there is no harmful effect was noticed after taking Mahadanandara Gulika. But we can say within a single words itself, but there is or research papers or some scientific evidence we needed to prove it. It's our responsibility. But some controversy or some discussions are regarding this Mahadanandara Gulika. It's noticed that the volume of the amniotic fluid will be reduced. That is the one major findings which are to be done by somebody or some not this. But I found that from our common practice, if they are taking Danandara Gulika, there is no reduction in the amniotic fluid is noticed. In my experience, we can add any other if there is any other experience you can share, but in my experience I didn't find if there is no reduction of the amniotic fluid after taking this Mahadanandara Gulika. But if there is any heartburn, is there any abdominal difficulties, we can very comfortably we can use this Mahadanandara Gulika. Then like Shadangapana, if needed, we can take this Shadangapana. It's a better option. If not only in the same as a proper care, but as a part of this, their conditions we can administer. Next. Like that, Bala Jeeraga Nagara, like Nayopaya in Nayopaya Kashaya, by adding this Bala in more quantity, this more Bala, less Jeeraga, and very less quantity of Nagara by prepared home itself, not as the means bottle Kashayas. Instead of that, we can prepare at home, and it will be helpful if there is any gastric irritations or heartburn, then abdominal pain or then back pain, etc. will be reduced on, especially on the first trimester itself. We can give this Bala Jeeraga Nagara, the Nayopaya combination, but it will be better to give this more Bala, less Jeera and less Nagara. Then Phalasarpi from these ingredients and means as per the Phalashuddhi itself, we can know that it's act as the Garbhasthapana. On the first trimester, we have worried about is the implantation, and during this 12th week of the pregnancy, this placental formation will occur. So to getting the proper implantation or Garbhasthapana, we can add Phalasarpi, but it is somewhat guru. So according to the appetite of the or digestive power of the means Garbhini, we can add Phalasarpi. By adding small quantities of Rajanyadi Churna is also found to be more helpful to reduce that digestive problems. Next. Because we know that on the first trimester there may be nausea, vomiting, etc. Maybe there are chances. So we can by adding these small quantities of Rajanyadi Churna, it will be helpful to overcome that or rectify that problem. The next is the Lakshmana Mula. Lakshmana Mula, we know it is also act as the in a Pumsavana Karma, but even though apart from the Pumsavana Karma, we are practicing it as the Garbhasthapana itself. So on the first month or second trimester, first trimester, we can add Lakshmana Mula as in the form of Ksheerapaga. Then in my experience, I found that so many cases having increased burning sensation, and maybe due to the presence of this progesterone hormone, the normal progesterone content, or otherwise after getting the sustained tablet and etc., they may have some increased body heat and mastalgia during that just after the ovulation and during the impregnation time. In such time, we can add small quantities of Shatavari Kruta, milk mixed with milk is also found to be helpful. Then same condition is to be found that in Ksheerabala, because some patients having this hypothyroidism, they may have this type of means increased body heat or burning sensation. In such conditions, we can add drop of Ksheerabala mixed with milk or Ksheera. It's also found to be beneficial. Next. The next, coming to the second trimester. Here also we can take this Nayopaya Kashaya. If there is any fatigue or tiredness, we can move to Drakshadi Kashaya. Then if there is any urinary problem or starting of edema, we can select this Brihatyadi. But here we should keep in mind that all these Kashaya preparations, it should be better to take as homely prepared and not in a much concentrated, so better to take as in Toya Bhaga, or if it is needed in the form of Toya Bhaga, is to be more beneficial. Then Stira Siddham Paiha, then Guduji is also mentioned in the second trimester. Then for external application like some Lakshadi Gara or Nalpamradi, we know some hormonal changes are appeared on the skin and abdomen, etc. Then next, internally, Dadimadi Gruda is also, we can select as a drug of choice during the second trimester. We know here mentioned it in the Pandu Chikitsa, and here this adding Dadimadi Gruda, during this time itself, the need of iron content is more to the pregnant lady. So that's why we can add Dadimadi Gruda on the second trimester, and the starting of the third trimester itself, it will be better. Next. In some classical practices are going like that. On the fifth month, some Kalyana Gruda or Brahmi Gruda are given to the because some old as a traditional practice, it is found that they are explaining the reason behind selecting this Kalyana Gruda or Brahmi Gruda on the starting of the second trimester or on the fifth month. It is found that during the development of the fetus or embryology, Chedanayasha Panchame, the formation of the Chedana during this fifth month. So that's why adding this Kalyana Gruda or Brahmi Gruda during that time to get a better development or the means brain development of the fetus, it will be helpful. That's a traditional practice, just I am putting here. Next. Then third trimester on the starting, here this Dadimadi Gruda is a choice. Then coming to the end of the or after 8th month, Sukha Prasavada Gruda or Sugumara Gruda in small quantities are also a traditional practice. Actually, after completing the 8th month, it is enough to getting more anulomana, is the action of the Sugumara Gruda or excuse me, Sukha Prasavada Gruda, which is the anuloma action. So after the 8th month of the completing the 8th month, it will be better to advise this Sukumara Gruda or Sukha Prasavada Gruda. Then here also this Balaji Ragadi Kashaya is to be, if needed, it will be helpful. Then Shadavari Ksheerabhaga, we know as a preparation of the means breast milk and breastfeeding, this Shadavari Ksheerabhaga will be helpful. And if there is any weight reduction or the baby is not having the proper weight gain, then we can add Vidaryadi Kashaya as the Ksheerabhaga. It would also better to improve if there is proper acne, then proper blood circulation is there. Then by adding this Vidaryadi Ksheerabhaga, within 2 weeks, we know actually the last month or last 2 weeks itself, the important time for getting the weight gain. So during that time, if there is less reduced weight gain, we can add this Vidaryadi Ksheerabhaga. Then next. According to Kerala Chikitsa, this Ksheerabhaga of the following drugs are to be used. Like we know, all of us, we know that from Pradhame Garbha Masi to Bala Siddham Payaha, the next second is the Lakshmana, third month Brihadi Doya, third Amshumadi, fifth month Amrita, sixth month Dittiga, seventh Yavagam, 8th month Morva, and 9th month Shadavari. Next. Just we are going to one point regarding these drugs. First one is the Bala, that's Sida cordifolia. Here is having Rasa Madura, Snigdha Guru Guna, Virya Madura, and Vipaka Shida. Here Mutra Kricha, then Bahu Shosha, Rekta Pitta, and Daurbalya, etc. are the therapeutic indications. Then second is the Lakshmana. Second one, it is mentioned as the Lakshmana for the Kshira Bhaga. Madhura Rasa, Guru Ruksha, Shida, and Madhura Vibhaga. Here also having the property to get proper implantation or otherwise for the Garbhasthabana. Then Brihadi Dvaya. Brihadi, it's having Solanum indicum and Solanum Sandocarpum. Here both having the same properties. Kadu Dikta, Lagu Ruksha and Tikshna, Virya Ushna, Vibhaga, Kadu. Here Sambrahi, Pachaka, then Aruji Hara, Jora, Jarahara, and also with the Pirasakna. Then next, these are the first 1, 2, and 3rd month. Next slide. Amshumadi. The next month is the Amshumadi. Amshumadi is having rasa, this Desmodium changenticum, Madhura rasam, Guru snigdam, Shida viryam. All these drugs having mostly Shida virya and Madhura rasa are the peculiarities of these drugs. Then Kasa Shwasa, Krimi Chartihara, etc. are the therapeutic indications of Amshumadi. Then next is the Amrita. Here, Tikta Kashaya rasa, Guru snigda, and Madhura vibhaga. Jara, Ambla Pitta, diuretic action, and Jarakna are the therapeutic indications. The next is the Nidiktiga or Kandagari Salanam group. Here, Tikta Gadu, Lagu Ruksha, Ushna, and the Vipagam. Here it is the Kadu, Pajana, Jarakna, Krimikna, Mutrala, and etc. are the therapeutic indications of this Nidiktiga. Next. Here Yava on the 8th month, Yava is Madhura Kashaya, Ruksha, Shida Virya, and Kadu Vibhaga, Adhistaulya, Balya, Leghana, anti-diuretic strengthening and Vajigarana. Then Murva, here is also Madhura Tikta, Guru Ruksha, here anti-tumor effect, Rekta Pitta Hara, Prameha Hara, Krishna, and Krishna, Charti, and Ashohara are the therapeutic indications. Then 9th month is the Shadavari, Asparagus racemosus, Madhura Tikta, Guru Snigda, etc. are the properties. Stanya Vardaka, Rasayana, Grahani, and the Shukla Daurbalya, Gulma, etc. are the therapeutic indications. So these are the drugs to be mentioned in Sahasra Yoga from first month of the pregnant to the up to the 9th month. Actually, in practically, if you are giving to the patient, it is not much palatable to the patients, and they are not willing to take complete month from first trimester to whole trimester. It would not be much easy to implement or much not easy to practice. But within a short days from the 1 month, it's my opinion is that if we are practicing few days, 1 or 2 weeks of 1 month, we can give this medicine. And if there is any difficulty, like if there is any edema, then we can add in such conditions. Or if on the 9th month we can select this Shadavari. If there is weight reduction, then Vidarya, like that we can, according to the condition itself, we can add this Chirapaka. If they are willing to take 2 weeks in a month, it will be better to implement. Next. Then coming to on this first trimester, within the 12 weeks, there is a chance of abortion maybe occur. So our intention not to get the failure to deliver, and rather than failure to conceive, to failure to deliver a viable child, that can be considered the term fertility itself. So the outcome is very, very important. The next, so from during the first trimester, on these 12 weeks, there are chances to get abortion, or otherwise there is a previous history of recurrent miscarriage. Next slide. There is a previous history of recurrent miscarriage is happen. Then we have to move in such conditions. We have to give some other medicines. Hello. Next slide. Garbhasrava and Garbhavada are the two terms. Here this Garbhasrava, it is occurred on the before the 4th month as in the form of liquid form, and Garbhavada after the 5th or 6th month. In Ashtanga Hridaya, it is to be described that if there is a history of, there is a previous history of miscarriage on the 1st month, then you have to give such and such medicine. And if there is a previous history of miscarriage on the 2nd month, then you have to give such and such medicines. This type of pattern are to be described from 1st month to the 9th month of the pregnancy. Then next slide. Hello, next slide. this incidence of this miscarriage, it will be 10% induced, 75% it will be on the 16th week, and 80% will be on the 12th week. Next. So there may be the 5%, it may be due to the infections like viral, like rubella, cytomegalovirus, or bacterial, chlamydia, and parasitic like toxoplasma or malaria, etc. may be there. Next. Here, this type of a torch group of infections, we can give if there is a previous history, and after abortion, such patients are coming to us. We just move to some Shodhana Chikitsa, and after that, we have to give some medicines or for the Garbhini Paricharya. Here, not only on the first month or from the first 12 weeks itself, we should completely monitor that patient without having the means placental breaking, because the torch infection, there is a chance to break the placental or viral placental means breaking up to these 12 weeks, and this means acute infections. There are two type of viral infections, maybe the IgG and IgM may be found. We found that in the past history of the or IgM, the presence of IgM is also responsible for the in some cases it may be found in patients with repeated pregnancy loss, but in we described that in modern it's only the IgM or acute or present infection is only responsible, but even though if there is a past history, then we have to take proper care. Next, in such cases, the Shodhana Chikitsa and also then some Garavisha treatment, etc., are given to the means patient before coming to the next pregnancy. Next. Next. These are some documentations. I think it's not needed here. Then that are the medicines which are described as the Madhukam Shaga Bijamcha Payasya Suradaruja Ashmandaga Krishnadila Damravalli Shadavari. We know from Ashtanga Hridaya. That is the name. What are the available drugs we can select and prepare the Kshidapaga and given to that pregnant lady if there is having a previous history of recurrent miscarriage. Then Madhukam, Shaka Bijam, Payasya, Suradaru are the group of drugs which are to be mentioned if the patient is having first month pregnancy loss. Then Madhura Kashaya Rasa, here which I am not describing this each and each drug. Next, the second month. Next slide. On the second month, if the pregnancy loss is happening, then Ashmandagaha, Krishnadila, Tamravalli, and Shadavari are the group of drugs described. These available drugs are to be collected and made Chidabaga and given to that pregnant lady on second month. Next. Here on third month, if the pregnancy loss happened, then Vikshadani Payasya, Ladacha Ulpala Shariba. Here also Vikshadani is having Madhurarasa and Ropana, Vajikarana, Garpastapana, and Vanditto as the action. Then Payasya itself here is having some Rasayana property, Lada, Ulpala. Most of the drugs are described here as the Garpastapana properties. Then next, fourth month. Fourth month is the Ananda Shariba Rasna, Patmaga, Madhu Ishtiga. Ananda is having Madhura Tikta Kashaya Rasa, then Shariba, Tikta and Madhura. Rasna is having Tikta, Vadavyadi, then Amavada, means Shasahara, Kasakna, etc. Patmaga and Madhu Ishtiga. Next month. On the fifth month, it is having Brihadi Dvaya and also Kashmirya are the drugs are to be mentioned here. Next. Sixth month, it's having Krishni Varni, Bala, Shigru, Shadamshra, and Madhuvarniga. Here also, if the patient is having any signs of bleeding or miscarriage on the sixth month, we can add Chidabaga by taking this group of drugs. Next. Seventh month, Shringadaga, Bisa, Draksha, Kasheru, Siddha are the ingredient of the drugs. Here also this Shringadaga itself is having Garbhastapana, Bisa having the properties of Garbhastapana, and Vedana Stapaka. Then Draksha, Brahmana, Vadarektahara, Chakshushya, etc. Kasheruga, the same, and Siddha is having Madhura, Guru, and Snigdha. Then next, 8th month. Here is the Billua, Brihadi, Padaola, Ikshu, and Nidittiga are the group of drugs. There is a tendency to get miscarriage on the 8th month. Then next. Then on if it is occurred on the 9th month, Shariba, Ananda, Payasya, Madhu Ishtiga. Here Shariba, here Ananda, Payasya, and Madhu Ishti. All these having this type of properties to means prevent abortion or if there is chance, we can add. Next. If it is occurs on the 10th month, then Madhueshti, Nagara, and Devadaru are to be mentioned to prepare the Ksheerapaga. This is the reference from Ashtanga Hridaya itself. We know that from the if there is a history of miscarriage, we can add to prepare the Garbha Raksha Kashaya or the means Garbhastapana by adding these drugs. Next. Then next portion of this presentation is the there are so many doubts that to be happening if it is whatever the medicines we can take, if there is any common cold or pinasa or kasa is happening to the garbhini, or whatever the things we have to avoid it. Is it possible to take Vetamaran Guliga, or is it indicated Shwasananda? There are so many doubts are commonly happening. If there is any simple drugs itself, there is doubtful. Is it needed to take, or even simple Vilodilekha itself, there may be doubtful. Is it possible to take like that? So that some drugs we can discuss a few combination of the drugs here. What should be we can take during the pregnancy and what should be avoided. I think it should be contraindicated like rasa preparations like Chukundipalyadi Guliga, Vitamaran Guliga, Shwasananda, then more Tikshna Kashayas like Dashmula Gadatraya, then Elaganadi Kashaya, Vasha Arishta. Vasha is having in modern itself they are told to be that it is abortifacient. That's why already this Arishtasava during the pregnant state or for the Garbhini, in our common practice, Arishtasava is not practicing. But if there is needed within a small quantity, in a diluted form, we are giving for short durations within 3 days or 4 days. It is not harmful to the Garbhini, but in a small dosage and in a small duration, for a short duration, in a diluted form, we are giving. But better to avoid Arishtasavas during pregnancy. Next. Here these drugs like the Shmula Kadatraya, if we are going to the Shmula, Pippali, Nagara, Marija and Vasha are the ingredient. Actually, the therapeutic indication which is having Shasa, Kasa, Pasha, Shula, Mridisvara, etc. But as per the ingredients of the Tikshrata of the drug, it will be better to means avoid. If actually if it is needed, then in a small quantities or otherwise, if there is other parallel drugs we can use, it will be better. Then Ela Kanadi itself, Ela Kana, Nagara, Avasha, Nimba, Amrita, Dashmula, etc. are the ingredients. Here also more Ruksha and Tikshna drugs are the ingredients of this yoga itself. So it will be better to go for the next choice. Next. And then also some churnas like Karpuradi Churna, the Namrdarishta. There is some common traditional practices. It is found that for if there is any gastric irritation for Garbhini, Dashmula Arishta, you may give Dashmula Arishta and Dhanantara Gulika or Apaya Arishta. But actually, in our school of thought from this educational system itself, it's found that this Arishtasava is not commonly practicing, I've thought. But very, very small quantities of Draksha Arishta within diluted form, if it is needed, we can add for within a short duration. Next, but better to avoid this Karpuradi Churna like Tikshna drugs. Then in the form of not much Tikshna, but to a small extent we can use this Amrdottara, Vyakhyadi and Indugandha Kashaya. Here this Amrdottara itself is in the form of Toyapaga or Vyakhyadi, Vyakri Shuddhi Amrita without adding Pippali, we can select Vyakhyadi. Then Indugandha Kashaya, Indugandha itself having in the Toyapaga, we can select. We should keep in mind that the bottle kashayas is not typically contraindicated to Garbhini. Next. Vyakhyadi, here Vyakri, Shundi and Amrita are the ingredients. Here this Vada Kapajara, Jaratna, Shasakasa, Shulatna. If there is any fever or pneumonia like conditions, we can select this Vyakhyadi Kashaya, but the formation should be keep in mind. Then Amrdottara, Nagara, Amrita and Haridigi, here it is having Analomana. But if there is any rheumatic pain to Garbhini occurs or viral infections or like fibromyalgia, then Jara or Shopa, Kamala, etc., then we can add it is in the form of this Toyapaga. Then Induganta Kashaya, here Pudika Daru, Deshmula, Manjakola, etc. Here itself. Here also it's some Tikshna drugs. If it is needed, like bronchial disease and digestive tract diseases, etc., are the practical indications we know. These are the drugs, not much Tikshna to Deshmula Kadatraya and Elakanadi, but as a medium side, we can select this drug. Next. Here also this Vilwadi Gulika, Sudarshana Gulika, Talis Patradi Churna, Deshmula Rasayana, Mridhugadi Lehya. These are also having, if needed, we can implement it in a short duration. Next. Here this Vilwadi Gulika is having Vilwa, Tagara, Tripala, Daru Haridra, Bastamutra, etc. are the ingredients. So that's why for a extended use of these drugs is not contraindicated. Even though Sudarshana Gulika or Vilwadi Gulika for a continuous use is contraindicated. Next. Then some safe drugs, how we can use some safe drugs during the pregnancy. One is the Shadangabana. The next is the Nayobaya Kashaya, especially less Jeera, Shundi, and more adding by adding more Bala. Then Guluchadi, Drakshadi, and Vidaryadi. These are the safer side we can move to prescribe for a Garbini. Next. Then next is the Gobi Chandanadi Gulika, Danandare Gulika, Sidopaladi. Instead of this Talisapatradi Churna or Karpuradi Churna, we can move to Sidopaladi Churna. Then Haridra Ganda is more safe. Then Vilwadi Lehya safe. Vidaryadi Gruda in some type of the Garbini which is having the chronic cough and which is in dry cough. If there is proper acne, then Vidaryadi Gruda is to be practically found to be very effective. Then Pravala Basma in small quantities it will be we can administer. These are the some safer side. Next. Here the Danandara Gulika, here the ingredient Ela, Abaya, Jati, Prahadi, Budimba, Rudraksha, Karpura, etc. are the ingredient for this Danandara Vadi. Then Vatakapa Shamana, Vatanu Lomana, Shula Prashamana, Shasakasa Charti, Nigraha, the therapeutic indications. For the practical indications like Garpini, Vaishamya, Sutika, Mutra Krisha, abdominal discomfort, pulmonary congestion, etc. will be the practical indications. Then Gopi Chandanadi itself also the Rekta Prashodana, Srodo Shodana, Bala, Jarakna, etc. are the means therapeutic indications. Some allergic conditions, sneezing, colds, and anti-infective, we can select Gopi Chandanadi Gulida. Next. Then Shadangam is having Kanachandana, Shuddhi, Ambu, Parpada, Shida Sadidam. If needed, we can reduce the quantity of the Shuddhi. But even though in the form of the Shadanga Kashaya, it will not harm much harm to Garbini, Pitta Kapashamana, Rekta Pittahara, Amma Pajana, Atisara, Vishajanya Jura, etc. Then Nayobaya, we described earlier. Next. Then the difference between the Nayobaya and Balajiragadi here, Balajiraga and Nagara alone in the Nayobaya, but Balajiragadi here this Vidya, Musta, Nagara, Devadara, etc. are the some additional drugs. Here both is having in dry cough, exceptional dyspnea, etc. The abdominal spasm are the common therapeutic or practical indications. Here I found more apt to use the drug is the Nayobaya itself. Next. Then Drakshadi. Draksha, Maduga, Lautra, Kashmiri, Shariba, etc. are the ingredient. Here, Pittavada, Shamana, Brahmana, Charti Hara, Jarekna, Kshina Hara. Here, this hypertension, general debility are the practical indications. So, we can select a Drakshadi Kashaya in the form of means prepared one for the Garbini. Then Guluchadi Kashaya, Guluji, Patmaka, Rishta, Dhaneka, Rekta Shamdana. Here, Pitta Shamana, Rekta Prasadana, Dibana Bhajna, and Jarekna. Here this also for especially on the first trimester there may be urinary problems or any there is due to this progesterone hormone there may be body heat or burning sensation, so that will be reduced by Guluchadi Kashaya. Next. Even though this Guluchadi Kashaya can be used, better to take the Kshira in the form of Kshira Paka. So even this Guluchi itself or Guluchadi Kashaya, we can implement it as in the form of Kshira Kashaya. Then some yogas like Haridra Ganda and Sidopaladi, the pregnant ladies with they having some allergic rhinitis or allergic conditions, then Haridra Ganda is more safe. This Haridra, then some Trikadu Trajada is there, but even though as per the properties of this therapeutic indication, it is not harm to Garbini. Kapashamana, Deepana, Rekta Prasadana, Tok Prasadana, Vishatna, and Kandugna. Then Sidopaladi Churna, we are not using as a common practice for the antenatal care, but if there is any complaints or whatever the medicines or beneficial medicines, we can add to the Garbhini that we are discussing. Then Sidopaladi Churna, if there is having any Kaba or Shwasakasa, instead of Karpuradi Churna or Talisavitradi Churna, better choice is the Sidopaladi Churna, because Sidopala, Vamshalojana, Tok, Ela, and Pipali are the ingredients of the Sidopaladi Churna. Next. Then we know the Phalasarpis we described here, this Vata Pitta Shamana, Brahmana, Balya, Garbha Pushti, Yoni Dosha, Shukla Doshatna, then especially in cases habitual abortion or recurrent pregnancy loss, then after the ovulation itself, we can start the Phalasarpi for getting the proper implantation. Then Dadimadi Grida we described earlier, Dadima, Daniga, Chitraga, Shringavera, etc. are the ingredient. Vatanulomana, Grahi, means Shasa Kasa, Panduhara are the Gulmarshas, etc. are the therapeutic indications. Then chronic gastritis, anemia due to nutritional deficiency will be the practical indication. So we can select this Dadimadi Grida on the second trimester. Next. Here this Sukha Prasuti Grida, here this Nalikeda, Chida, then Bala, Mula, Shundi, Chiraka are the Dravadravya, Dadimatak, Danika, Shundi, etc. are the Kalka, and indications are the Sukha Prasavada and the Garbha Vadobadrava. Here itself, after the completion of the 8th month, we can add this Sukha Prasuti Grida. Next. Sukumara Grida, we know most commonly we are not much practicing in the Garbhini, but on the last trimester, if there is any constipation and needed more analomana, then we can add some small quantities of Sukumara Grida. Next. So some then it is to be better to do the Yoni Piju by using this Baladaila or the Anantara Daila, and on the external application from the 7th month or even 5th month itself, the local application of this Danandara Daila will be beneficial. So here, but Yoni Piju in the form of the not last trimester, but after the starting of the 9th month is to be advised. Next. Here the Pindadaila, some external application we know. I'm not going to that area. Next slide. Here it is the Bala Ashwagandha Daila. Here also this Bala Ashwagandha etc. means the ingredients are the Vata Shamana, Asti Sandhanakrit, Brahmana, Vrishya, Medhya, and Daha Prashamana. Therapeutic indications having for the Bala Ashwagandha Daila, especially we are using for this external during the internally it may be have different actions, but for the Garbhini we are using it for the externally. Next. Then Nalpamra Daila, if there is any skin changes during this pregnancy or like asthma and hormonal changes may be there on the skin. So we can select this Nalpamra Daila from the last trimester itself. Next. If there is any back pain and such conditions, here the Nayopaya Kashaya, Danandra Gulika, then Vidaryadi, here this Vidaryadi Kshirabhaga is to be found effective in chronic low back pain to the pregnant ladies. Next. If there is any constipation, each thing I'm not going to describe, but here what are the things we can add, like Nayopaya Kashaya, Danandra Gulika, Triphala Churna. Some doubts are to be coming that is it possible to take this Triphala Churna to the or Avibhatti Churna or Erenda Daila, etc. may come. So for having the better laxative during the Garbhini, it should be having more laxative purpose. Mridu Anulomana or Mridu Shodhana drugs are to be advised here, like Triphala Churna, Draksha, etc. will be good. Next. Then the first trimester itself, there may be some Garbhinis having edema on the foot or any different part of the body. If it is a chance to preeclampsia or like eclampsia-like symptoms, then it will be on starting from the 5th or starting of the 6th month itself. Then we can add this Kuluchadi Kashaya or Gokshuda Punarnavadi Gulika, Chandraprabha in small duration for small doses. We can add in such conditions. Next. If there is any from our dispensaries itself, the patients will tell that Prameha Aushadhi is it we can take for along with this insulin or along with this Prameha Hara drugs for modern diabetic management. What are the choices to add means through Ayurveda, like Nisha Kadagadi in the form of Toyapaka and or Prameha Aushadhi Churna, Nisha Amalagi to an extent we can give to as a supportive drugs. Next. Then if there is weight gain, there are so many other good combinations to we have like Vidaryadik Shirapaka, Vidaryadik Ghruta. Vidaryadik Ghruta is having Brahmana properties along with the, we can use as a means Kasahara during the especially dry cough during the to the pregnant ladies. And then Kushmanda Avaleha is also better to select. Next. We found that during the COVID era or COVID time, by using this coronavirus itself, this Kushmanda Rasayana and Chavanaprasha are the very common drugs we are given to that Garbhinis or pregnant ladies after infecting this COVID or coronavirus. This Kushmanda Rasayana and Chavanaprasha are the drugs without having much complications, without having much side effect or this post-COVID effect are to be very much was found to be very much reduced by adding this type of Rasayana drugs to Garbhini. Next. Then this Vidaryadi Lehya itself, to get a more weight or a weight gain, this Vidaryadi Lehya can be added on the last trimester. It's having the Hridya, Brahmana, Vatapitta Shamana, Shosha, Gulmahara, Angamarda, Urta Shwasa, and Kasahara, etc. are the indications of the Vidaryadi Lehya, and its reference from Ashtanga Hridaya Sutrasthana. Then coming to next slide. That is the Vidaryadi Grudha. More than Lehya, we are preferring this Grudha preparations. Here Vidari, Erenda, Vrishtigali, Punarnava are the ingredients. Here Vada Kabahara, Shosha, Gulma, Urda Shwasa, Kasa are the therapeutic indications. Here these practical indications of the Vidaryadi having is as previously mentioned, that is the Brahmana properties along with chronic dry cough to the in the antenatal period, headache or then weight gain, etc. The much practical indications. So there are so many drugs in our there are pool of drugs to our practice to normal. Each and considering each and every formulations or each and every drug or each and every food products itself, the pregnant ladies may be have doubtful. Is it indicated or contraindicated? We have to discuss and put an output we have to put on a list. Then how it is practiced. You may take the next slide. We can practice whichever will be needed. And whichever will be practically useful or not useful, but from the experience itself we can share such knowledge and like that. Thank you for this opportunity. I think the time it will be within this short time. This will be the this means within this short time of it's allotted. I think hopefully. Thank you.
Thank you, ma'am. Now it's time for discussion. Delegates can now raise their suggestions regarding the same.
Hello, am I audible?
Hi, sir.
Hello, Dr. Asnabi. As usual, your presentation was very nice.
Okay, thank you, doctor.
I just have a question regarding that Shirapaga.
Okay.
During pregnancy, we are prescribing Shirapagas, no? Palkashayas.
Okay.
So, is there any relationship between amniotic fluid index and Shirapaga? Have you ever noticed? Is there any reduction in amniotic fluid happening due to Kshira Kashayas we are prescribing, or any relationship between? Please explain.
Actually, Kshira is having, there is no chance to reduce the amniotic fluid. But if you are taking this Kshira Bhaga or Kshira, in generally, these pregnant ladies are using Kshira itself. So by adding these medicines, how it is possible to reduce the amniotic fluid? I think there is no such observation is noticed. Is a doctor asking from, is there any from reference?
Yes, yes, from my personal
Or in
experience, only one or two cases I have seen that there was IUGR, and
okay,
naturally some doctors, some of the Ayurvedic practitioners has prescribed for Kshiravada, and
okay.
after taking Kshiravada continuously for 1 or 2 weeks, the amniotic fluid has reduced drastically. Maybe it's not related to Kshiravada, but I suspect it, so I was asking this question.
Okay, doctor, in cases of IUGR, there may be already any problem to the fetus and in the production of the amniotic fluid. It may be chance of reduce the amniotic fluid is there. This is the same observation told that by using the Dhanantara Gulika itself. Because if, yeah, if there is the patient or if there is the Garbhini is having chances of reducing the amniotic fluid, there may be any type of congenital abnormalities or problems to the fetus, or already there may be chance in cases of IUGR and in already reduced genetic problems. But if you are adding the Kshiravada, it's not an observation found. Due to that reason, the amniotic fluid is reduced.
Okay,
Because
thank you.
Shira is anabolic, and these Shira preparations, if there is having proper Agni, if we are adding some anabolic type of drugs or food, is there any chance to, there is, I think there is no chance to reduce the amniotic fluid. There may be any underlying pathology to that fetus regarding that cases. That is my observation. We will notice it clearly in coming situations.
Okay, thank you, thank you.
Ma'am, one more question is there by Kirtana N. Is Ardraga contraindicated for pregnancy in class 6 as it is Tikshna and increases Pitta compared to
Which,
Shundi?
which,
It can,
which, the
ma'am,
question is not clear.
ma'am, it is asked by Kirtana N. Is
Okay,
Ardraga indicated for pregnancy in class 6 as it
okay.
is Tikshna and increases
Actually,
Pitta
Adraga
compared
is
to Shundi?
Tikshna, not as a common means antenatal care. We are not adding much Adraga, but if there is reduced appetite, if there is any amatha to Garbhini, and if there is vomiting, then in the form of Laja Adraga, Laja and mixed with Adraga is a combination to getting more palatable and to reduce this nausea and vomiting. For that reason itself, we are using this Laja Adraga. And not otherwise, Adraga is not much indicated. Hello.
Thank you, ma'am. Hope there are no other queries. Now, I invite Dr. Shaini S. Raj, Associate Professor, Department of Prasuti Tantra and Sri Roga, Government Ayurveda College, Kannur, to express our sincere thanks to Dr. Asmabi for this valuable session.
Thank you. Can you hear me?
Yes, ma'am. Thank you.
Thank you, Dr. Asmabi. It was really a great time with you. The session was very elaborative and informative. Selecting Aushadas in Garbhavastha is not easy as selecting for others. In spite of this situation, you have selected effective Aushada yogas for the same, especially from your experiences. On behalf of the Prasudi Department, Government Ayurveda College, Kannur, I would like to extend my heartfelt gratitude for the presentation. Thank you, Asmavi, and thank you all.
Thank you, ma'am. Thank you.
Thank you, ma'am. Now, moving on to the next session. The next presentation is on the topic Common Ailments in Antenatal Period. The paper will be presented by Dr. Rejida R. Warrior, Associate Professor, Department of Prasuti Tantra and Sri Roga, Government Ayurveda College, Tripundra. Dr. Rejida R. Warrior is a skillful Ayurvedic practitioner and academician with expertise in Prasuti Tantra and Sri Roga. She completed her bachelor degree in Ayurveda from Vaidyaratnam Ayurveda College, Olur,
in 1999 and post-graduation in Prasuti Tantra and Stri Roga from Government Ayurveda College, Thiruvananthapuram in 2008. She started her career as teacher at RVS Ayurveda College, Coimbatore. Further, she worked as medical officer in the Department of Indian System of Medicine. Currently, Dr. Rajida serves as Associate Professor in the Department of Prasuti Tantra and Stri Roga at Government Ayurveda College, Tripunithura. Concurrently, she pursues a PhD at Kerala University of Health Sciences. She is actively involved as a resource person in many CME sessions, conducting awareness classes and delivering insightful talks at seminars, and has significant role as a co-investigator of Madhurjam Antenatal Project. With all regards, we invite you, ma'am, for the presentation.
Hope I am audible.
Yes, ma'am.
Is it clear?
Yes, ma'am.
Okay, thank you, Smita, for your kind words. And first of all, I thank Dr. Asha teacher and Prajita for inviting me to this CME, and the audience beforehand for your patient listening. Since it's a teacher, it's already busy. There's a little bit hurry in changing the slides. Is it visible, the slides? Slides are visible?
Yes, ma'am.
Okay. So coming to the common ailments in pregnancy. Everyone knows that during gestation, the maternal body should increase its activity in order to fulfill the demands of the developing fetus. As the pregnancy progresses, it should increase the activity. So each maternal organ adapts in a unique manner and at a different time during pregnancy. So the physiological changes that healthy pregnant women face include a pro-atherogenic metabolic state. That means it's a resistant state to the maternal nourishment, because the nourishment is more directly to the fetus. And there will be increased cardiac output, hypercoagulability, and high inflammatory response. After mid-pregnancy, the insulin resistance and hyperlipidemia reach their peaks. So after 24 weeks, pregnancy-related complications becomes more prevalent. So the common ailments, we can divide it as minor and major. The minor ailments or minor conditions will be, in an exaggerated version, it can be converted, it can be manifested as major ailments. So most of the disorders of pregnancy is as a result of minor disorders that happens due to hormonal changes, accommodation changes, metabolic changes, and the postural changes that are fairly specific to each of the 3 trimesters. So coming to the major, when the maternal organs are unable to compensate the demands that increase with the increase in the gestational age, then organ or the system that was already vulnerable before the pregnancy, that becomes a burden for that organ, as the pregnancy can trigger overt clinical manifestation. So the pregnancy can be considered as a medical stress test for the mothers. Coming to the ailments regarding each system, first of all, the digestive system. The most of the symptoms include mainly morning sickness, tirelism, heartburn, and constipation, and pica. The morning sickness, it appears in the first or second missed period, usually the 6th week to the 16th week. It can continue longer or return it around the 32 weeks. It usually happens in the morning, soon after getting out of the bed. These things are very common. You may be knowing all these things, but just to remind something, usually it's common in primigravida. 55% of women have both nausea and vomiting, 25% only having nausea, and 25% may be unaffected. Most commonly occurs in the first week, it's already told, and it is usually related to the HCG. So the reason are the HCG, increased HCG levels, enhanced sense of smell and sensitivity to odors, and then increased sensitive stomach. Then the psychological stress may add and multiple pregnancy to be ruled out. So coming to the management, eat small amount of food. This can be suggested to the patient, and quit smoking if she has the habit, and she should be kept under good ventilation, get plenty of rest and sleep, avoid lying down just after eating. Some dietary changes has to be mentioned, to be suggested, and behavioral modification also to be suggested. If it is a severe way, hospitalization may be necessary, and to correct the fluid and electrolyte imbalance. So avoid eating deep fried and greasy food. So try some dry food that will be better. Coming to the next symptom, heartburn. It is usually due to the relaxation of the esophageal sphincter and the hiatus hernia. It is otherwise known as pyrosis. This results from gastroesophageal reflux disease in almost 10% of gravidas. In late pregnancy, it may be exaggerated due to this displacement of stomach and duodenum by the uterine fundus. It is likely to occur when the patient is lying down or bending over. So the cause is the relaxation of esophageal sphincter and decrease frequency of stomach emptying due to the effect of progesterone. And enlarged uterus can crowd the abdomen, pushing the stomach acid upward. So the overeating should be avoided, and that too, not to go bed immediately just after the meal. Antacids can be used. And coming to the next symptom, constipation. It is usually very common, and due to the atonicity of the gut. So the passage of the food, the movement of the gut will be very much reduced. The diminished physical activity and pressure of the gravity should exaggerate the symptom. Emotional stress, minimal physical exercise also add to that. So the management, assure the ample fluid intake, purgatives should be avoided, and good exercise and bowel habits, we can suggest that, and increased dietary fiber should also be included. Increased secretion of saliva is observed during the pregnancy. It's hrilasam, can be considered as hrilasam, and there will be it may be associated with increased intake of starch. Actual cause is it is said to be unknown. And coming to the management, it need not be more need not more emphasis, give more emphasis on that. It's usually self-limiting. Coming to the pica, this is a term when the mother craves certain food of unnatural substance, which is called. The cause is usually unknown, but some hormones contribute to this. In our text, it's a very good description of fetal desire is expressed through the mother. If the substance is craved is harmful, it should be kept under medical advice. Deyamapyahidam hidobahidam alpagam. Now let us discuss some of the clinical scenario. A 20-year-old primary gravida with 9 weeks pregnancy, when complaints with excessive vomiting comes to you, we have to ask from the history onwards. If it is we have to ask the frequency. If it is mild, once or twice, of less quantity, seldom affects the health of the mother, it usually be physiological. But if it persists, increase in frequency, it's very little nourishment. It gives very little nourishment to the mother, and if the mother loses weight, then it comes the hyperemesis. If it is associated with some abdominal pain and burning sensation, then it comes because it is much more affected with this gastritis, and the type of vomitus, we have to ask whether the type is bilious or blood stained. That will suggest the chronicity or the symptoms. And the period of amenorrhea, where if it is 6 to 16 weeks in between, it usually it will be emesis or hyperemesis. If it is beyond 16 weeks, there are some other reasons for multiple pregnancy, molar pregnancy, and acute hydroneus has to be ruled out. So coming to the main causes of the condition, the medical conditions are worm infestation, UTI, hepatitis, diabetes. All these things has to be ruled out. When the patient comes to you with a vomiting, and that too with excessive. If she says that it's excessive, these things has to be, the medical conditions has to be ruled out, and the surgical condition also acute appendicitis, peptic ulcer, intestinal obstruction, and polycystitis. These are the major causes. And coming to gynecological, we should not deny some of the gynecological symptoms, gynecological causes, twisted ovarian tumor, red degeneration of fibroid. When we examine the patient, the general condition has to be monitored, and the dehydration and the complications we should keep in mind. In dehydration, the sunken eyes, thickly coated tongue, dry inelastic skin, and smell of acetone in breath. That gives a clue of hyperemesis, and if it is not cared, that manifests the complications will be manifested: fluid electrolyte imbalance, acidosis, jaundice, and some of the neurological manifestation of squint and nystagmus in very severe condition. When we do an examination, vaginal and abdominal, the normal pregnancy, early normal pregnancy should be confirmed, and to rule out the multiple pregnancy and hydramnios, all this should be ruled out. Coming to the investigations, urine output. If we do a urinalysis, urine output, and if it is concentrated, high specific gravity, all these things suggest the condition of dehydration. And bile salts, bile pigments, sugar, acetone with ketosis, and the blood electrolyte imbalance, low sodium, potassium, and acidosis, ketosis, hypoglycemia. All these things hint the starvation. So all these things to be kept in mind. So these are the complications which is already told in our text. Termination is needed if it is the condition is deteriorates at a speedy rate, associated with pyrexia, hypertension, tachycardia, oliguria, proteinuria, jaundice, etc. Coming to the management, is already told in the previous session. Most of the yogas are discussed. Now, coming to the main treatment principle, surgical conditions must be ruled out, and the Chardi Chikitsa, as we know, and main aim should be Vada Vaigunyam. We have to address the Vada Vaigunyam, and we can make use of Chardiknagana, Hridyam, Jeevaniyam, and Prenatal. And the medicines which we can concentrate on are Laja, Nagara, Madhiphalam, and Villo. Coming to the abdominal pain during pregnancy, which is also related to the gastrointestinal system. So think of a clinical scenario where the second gravida presents with 24 weeks of pregnancy with abdominal pain for 2 days and also associated with vomiting. Usually, the abdominal pain is it's a common finding because the mild form of abdominal pain is normal. It is physiological. Not normal is physiological due to the uterine distension, some displacements and pressure on the adjacent structure, and due to the peritoneal stretching as the abdomen enlarges, the uterus enlarges, and the round ligament spasm. If there is some tilt of the uterus happens, that part of the ligament will be stretched. And if it is a severe form of, so we should keep an eye on the condition. If it is severe, that can be an abruptio placenta or any other acute surgical condition. So here also we have to start from the history, because whether it's the pain is that we have to ask about the onset type, duration, severity, radiation, whether it is continuous or intermittent. Usually, if it is mild, it's already told it's a physiological, can be indescriptive and insidious and not persist. But if it is severe, it can be acute and persists and radiates. So if it is associated with some of these features, we can go for another diagnosis. If it is burning nature, related to food, it's distressing in late pregnancy. If it is in late pregnancy, then it can be considered as GERD because of this reduced barrier pressure. And if it is severe, associated with epigastric pain, we have to think of preeclampsia and imminent eclampsia, and that pain may be due to that stretching of liver capsule. And if it is a vague type of pain, may be of constipation. It may be due to constipation because it the pregnancy condition, there will be reduced gut motility, and the large uterus gives a pressure over the rectum and colon. If it is associated with vaginal bleeding, we have the condition is some other thing, because if it is discharge and hardening of the uterus and imminent intermittent colicky pain, and if it is radiate to the lower abdomen and medial thigh, we have to think of labor pain. If it is associated with nausea and vomiting, we know that it may be usually may be due to the urinary infection, and there is another surgical condition that can be of appendicitis. If there is the vomiting is intractable type, there may be chance of intestinal obstruction. If it is if there is hematemesis, the peptic ulcer has to be ruled out. And if it is associated with fever, dysuria, and chills, rigors, as already taught, this may be urinary infection. If it is hematuria, there can be another diagnosis of calculus. If there is associated with the diarrhea, tenesmus, and some of the intestinal infections has to be ruled out. If it is associated with constipation for a long duration, there is a chance of intestinal obstruction. If in the urine, if she says that there is some yellow urine, then it can be the jaundice and the liver condition has to be cholestasis has to be ruled out. We also have to discuss to ask about the menstrual history. If there is vaginal bleeding, the abdominal pain may be due to the abortion, or it can be of maybe due to ectopic. So abdominal uneasiness, pain, diarrhea, vaginal bleeding, vomiting, all these things gives a clue of abruptio placenta and acute abdomen. On examination, the general and systemic examination has to be followed. We have to look for the shock symptoms, and palpation percussion is usually difficult in a gravida. So these are the causes in a nutshell, which can be obstetric causes, urinary infection, surgical, gynecological, and medical conditions. Coming to the investigations already told, urine, stool, an ultrasonogram will give the maximum support to the diagnosis, and hematology to rule out. Hematology is not helping for the diagnosis, but to assess the general condition of the patient. Coming to the management, actually the surgical conditions again has to be ruled out, and the chikitsa according to the underlying pathology, if it is due to UTI, Mutrakrisa chikitsa, gastric complaints, Hamla Pitta chikitsa, Shula, Gulma, Udavarta, Grahani, all these things has to be in mind. Sometimes we have to adopt the Garbhastrava chikitsa, even Prasava, to be considered accordingly. Coming to the respiratory system, these are the symptoms usually: breathlessness, hyperventilation, nasal congestion, and epistaxis. These are the most common findings related to that system. Why this hyperventilation is the upward lifting of the ribcage due to pregnant uterus, and the progesterone hormone also plays a role in it, the enlargement of the uterus. Coming to the management, that postural changes has to be adopted and stay hydrated, and body weight has to be maintained. Obesity is one of the reasons for breathlessness. And yoga and light exercise will support. And while sleeping, some of the extra pillows, so that the reclining position has to be maintained. Nasal congestion and epistaxis and some other finding usually related to the respiratory system. This may be due to that increased vascularity over the nasal mucosa and increased blood volume. And hyperemia and edema contribute to that. And here it is not to be worried about this epistaxis. We have to stay calm and just pinch the nose so that it's a self-limiting condition. Need not worry more about that. Suppose this another clinical condition, just a clinical scenario in which 25-year-old premigravida, 32 weeks of gestation, complaining of breathlessness. What are the things we have to be differentiated? If she has an previous episode of breathlessness, we can think of bronchial asthma. If there is history of rheumatic fever and has had a treatment for that, rheumatic heart disease has to be kept in mind. And another thing, if there is blood loss, piles, and heavy bleeding precedes pregnancy, if she had a history of menorrhagia, and anemia has to be born. We have to think of that anemia. And if there is fever, cough, expectoration, hemoptysis, the respiratory system symptoms, and sudden history of abdominal distension usually happens in polyhydramnias. And some women may produce this symptom as a hysterical manifestation also. In physical examination, if she is very ill, and cardiac problems has to be ruled out. We have to check the respiratory rate, heart rate, BP, temperature, all these things. We have to look for pallor, cyanosis, and pedal edema. Coming to the systemic examination, all the cardiovascular system examinations regarding the cardiac conditions has to be examined, and the respiratory sounds has to be heard, bronchi, crepitus, and all the obstetric examination has to be done just to confirm the multiple gestation or rule out some other condition. And fluid thrill If it is polyhydramnios, there will be fluid thrill. In ascites also. In tumor, it will be absent. In anxious, disturbed attitude and exaggeration of symptoms on observation, usually will be a hysterical reaction. And if there is a septicemia, if due to that any of the infection spreading inside the all of the body, then manifest as acute respiratory distress syndrome. So in coming to the investigation, hematology with peripherals may to rule out anemia. Leukocytosis gives a hint of infection, and sputum, gram stain, acid fast bacilli for TB infection, and ECG echo for cardiology, cardiac problems, and pulmonary test for respiratory. Coming to the management, iron folic acid usually for anemia and to rule out hook form investigation. We know that Garpini Pantu Chigilsa and Krimihara Chigilsa, Vatanulominum here rules here again, Shwasa Kasahara and Hridroga Chigilsa. Pranava Manduram, Thatri, Loham, Dadimadi Kritam, Drakshadi Kashayam, all these things are possible. We can use these yogas. Coming to the circulatory system, these are the symptoms, supine hypotension syndrome or syncope, and then comes the varicose veins, then hemorrhoids and edema. Supine hypotension syndrome, syncope, can be caused by the inferior vena cava compression by the weight of the pregnant gravid uterus. And this condition develops as sometimes in the second trimester, or it may be more manifested in the third trimester. If the woman presents with dizziness or lightheadedness, that position change has to be suggested, and sudden change of the position has to be sure to avoid. We can recommend the recommend to avoid that change of the position, sudden change of the position. Also, dehydration, hypoglycemia, and overexertion has also to be looked for. It usually resolves, and actual hydration and the glucose content, blood glucose level has to be maintained. Coming to the varicosities, this also we know that the main reason is the gravid uterus itself, and some of the venous condition where the low resistance and easy permeability causes this varicosities and edema. So daily exercise and elevating the feet while lying down, and some massage with the abhyanka with thailam. We can give these things for the relief. Coming to the edema, we already told that the edema may be due to this hormonal hormonal changes, the increased permeability. And then increased pressure of the growing uterus on the vena cava. Coming to the management, avoid long period of standing and sitting, elevate feet, and perform some of the exercises, and very tight elastic shoes has to be, very tight elastic socks and the high heel shoes has to be avoided. Another clinical scenario where edema is the main presentation. A 20-year-old primary gravida with 32 weeks of gestation, if she presents with swelling feet for 1 month, we have to ask about whether the regarding the appearance of the symptoms, if it appears during a particular time, if usually in the end of the day it relieves by rest, it can be considered as physiological. Due to the water retention by falling plasma osmolarity because of the hormonal effect, and there will be mechanical obstruction to the venous return to the lower limbs, from the lower limbs. If it is persists all of the time, and if usually presents in the morning also, and not relieved by rest, it can be considered as pathological, and the conditions may be pregnancy-induced hypertension, cardiac failure, anemia, and hypoproteinemia. If the reason may be differentiated by asking about the associated symptoms. If it is happening in the dependent portions, can be physiological. In non-dependent portions, the face, renal, and upper limb, because maybe a pathology. If it is increasing, involving in other parts, increasing the severity, it may be due to preeclampsia, hypoproteinemia, and malnutrition, anemia. And if some of the occult symptoms may be there, before it we say we can plan. If we can sometimes suspect if she's having that edema, if feeling of heaviness, tightness, sudden weight gain. Sudden weight gain is an important feature because more than half kg weight in 1 week is giving a hint of she's maybe developing that symptom. If that edema is present in the early pregnancy, it can be due to multiple pregnancy, polyhydramnios, and molar pregnancy, because the over distension causes the symptom. If it is associated with headache and oliguria, pregnancy-induced hypertension has to be ruled out. In visual disturbances also, there will be eclampsia and diabetes also. And easy fatigue, malaise, and breathlessness, recurrent UTI. Anemic patients will be more prone to the recurrent infections. And that anemia has to be ruled out. And significant breathlessness, limitation of activity, palpitation, chest pain, orthopnea, and nocturnal dyspnea. This all give the hint of cardiac illness. And fever, chills, rigors, and unilateral swelling, that gives the hint of filarial lymphangitis. And glomerulonephritis is associated with that symptom, then it can be renal involvement. If she's presenting with jaundice, the hepatic involvement has to be suspected. Coming to the causes, if it is unilateral pitting, if it's physiological, if she's presenting unilateral pitting, unilateral edema with pitting, then physiological anemia, hyperproteinemia, preeclampsia, cardiac diseases, and renal hepatic diseases has to be kept in mind. If it is non-pitting, if it is tender, then there will be venous thrombosis, lymphangitis, and cellulitis. If it is non-tender, the filaria. Coming to the examination, all these things are already taught. The BP has to be monitored. 140 plus 30 or 690 plus 15 millimeter per mercury on 2 occasions 6 hours apart gives a hint of pregnancy-induced hypertension. All the examination regarding the above said conditions has to be done and to be monitored. Here also the management, Pandu, Shobhahara Chikitsa, and internal, external NEPAs are many yogas are can be prescribed from our text. Very elaborate descriptions are there in the Kashyapa Samhita. And Prameha, Staulyahara Chikitsa can be done here judiciously. And Garbha Stravahara yogas can be adopted. Upavishtaga, Garbha Shosha, and Garbha Shoshahara Chikitsa. Some of the drugs can be selected from those areas. And use of Amshumati, Brihati, Shariba, Arjuna, Yashti, all these drugs. Some of the research papers are some of the research papers we can see these descriptions. So in nutshell, we can give the guidelines. Medication is an individual choice for the patient, also for the doctor. Which medicine has to be selected is up to you. There are many yogas are there in the text. So one thing, low potency is preferred. And it should be palatable also, so that she can take that medicine. So it will be preferred in the tablet form, syrup form. If we need to prescribe some aristas, we can mix it with water. Krita and milk preparations are usually useful. Considering Amavastha, it has to be kept. We have to look for the Ama. Then in the Niramavastha only we can give the milk, Kshira and Krita. Strong medicines should always be avoided. If we need to give that medicine, reduce the dose, give it in divided doses, and duration of administration is also to be noted. We have to particularly mention that do not use that medicine for a long duration. Always specify quantity, duration, and inform any adverse reactions, and keep in contact of that patient, and we should follow the patient regularly. Coming to the musculoskeletal system, these are the common findings: backache, lordosis, and leg cramps. I'm going not into the detail. All these things you may be knowing. And coming to the neurological symptoms, sleep disturbances and carpal tunnel syndrome is the most. Some of the patient may complain of this carpal tunnel syndrome, which is already we cannot directly give that medicine. Internal, if we need some of the medicine, that we are the above said suggestions can be keep in mind. Coming to the neurological symptoms, the sleep disturbances. The reason behind the sleep disturbance may be urgency of urination, physical and emotional stress, excess daytime sleepiness, pressure of the growing fetus, heartburn, any other conditions that may hamper her the good quality of sleep. So caffeine should be avoided. Daily workout has to be enhanced. Warm bath, breathing exercises, meditation and yoga. All these things we can suggest for her. Coming to the genitourinary system. The frequency of urination in UTI, vaginal discharges are the symptoms regarding this system. In the frequency of urination, the cause is increased blood flow to the kidneys and HCG hormone and extra weight over the weight of the extra pressure of the uterus over the bladder during the early and the late trimesters. So if though she is having that symptom, usually she may be having the feeling of restricting the fluid intake. So we have to suggest, we have to always to make her sure that she is taking adequate amount of fluid. Never restrict fluid intake because there is a chance of UTI. Regular pelvic exercises and stay away from caffeinated drinks. Avoid drinking fluid right before bedtime. That can be suggested. And empty the bladder completely. Wear sanitary pads if it is needed. UTI is a very, very important symptom because many a time the UTI seems to be the sole reason for abortion and intrauterine death. We had such experiences. Two of my patient had an complaint of stillbirth or intrauterine death, and there is no other reason. She is not diabetic, so the unexplained death is usually attributed to that diabetes. But she had a history of urinary tract infection, that too recurrent. So there is a chance of recurrent urinary tract infection. This is a very, very important finding. We have to, or whenever we see a patient, see the pregnant lady coming to us, just give a urine routine because usually it will be asymptomatic. She may not complain of any urinary symptoms, but we must do a urine analysis to rule out the UTI. And it can be very much cured with our simple medicines also. So all these things are the genitourinary system or the vaginal discharge is very commonly seen. It has mainly due to the stimulation of estrogen and progesterone. The cervical mucosa is stimulated by these hormones, and there will be marked shedding because of this hormone. So the prevention and the relief measures should always she should always be kept in hygienic way. Integumentary system, the symptoms are itching, stretch marks. Some of the medications of Kikisa Chigilsa we can adopt here. So this is all about. Just I picked up some of the clinical situations. I think it is not complete. There are many symptoms behind that is fever during pregnancy and many other IUG, all these things are there. But I selected some of these because these are the very common things. Thank you, doctors, for patient listening.
Thank you, ma'am. Now it's time for interaction.
Hi, ma'am. Can you suggest the treatment for Staya gravidarum?
Actually, if once it is happened, it is very difficult to cure. But when we can suggest some of the preventive measures when when she becomes the pregnant, because from the starting months itself, try to use this Shadadauda and less salty food. There are many preparations are there, but usually I suggest some of the I suggest this Sharadauda Gridam Pintathylam, and there are some patent medicines are also available which claims to relieve the symptom.
Thank you, ma'am.
Any more doubts?
Actually, it is very late. You are going to there. Preventing preeclampsia. The actual prevention can be started from the preconceptional care itself. If she is having that history in the previous pregnancy, or usually it happens in the primary gravida, if she is having the family history, so it should be started from the preconceptional status itself. And all the preconception, the Ritu Mati Charya, along with Garbhadhana Chikitsa, to be started from there, and all the clinical conditions where all the systems has to be examined whether she is having that prone to situation. So all the things for that she should be treated first. Then only advise her to get conceived. Then that is the main prevention. Once getting pregnant, use all the suggested medication thoroughly. Actually, there is no record of preventing the disease now in hand with me or any other research purpose. That is why I am not in a position to directly this medicine will be effective. We cannot say that. These are the suggestions that can be given.
Thank you, ma'am.
Anti-epileptics already she may be using that drug from the that doctor from as a prescription of that doctor. Usually during the pregnancy, many of the drugs has there is advice to change. So I'm not having that much experience of treating epilepsy women getting pregnant with avoiding their medicine. I'm usually suggesting that, but I'm adding some of the drugs of Unmada and Abasmara Chikitsa because her child may not have that symptom, may not have that illness. That is the only thing. But she must be under the supervision of an expert doctor, and she has to be continued their medicine. I think it is better. That too, not teratogenic one. They usually change that medicine.
Ma'am, we have one more question in the chat box. Shall I read it? Ma'am, can you suggest how we can manage the early hypertension in antenatal care so that it won't progress to preeclampsia or eclampsia? Can we put on
It's
any
not
special
clear. It's not.
medication in
Where is that question? Where is that? Can you suggest how we can manage early hypertension in antenatal care? Early hypertension is so that we won't progress to the preeclampsia. So here we can adopt some of the pathyas. Already she is hypertensive. So what are the drugs she is using at that moment has to be continued, but that medicine has to be selected of less potent one. Usually I suggest that because Raktadimardam or hypertension is an endothelial dysfunction. So the medicine that having uh, uh, of the Hridroga Chikitsa has to be adopted. I think Hridroga medicines from that prakarana can be adopted here. And Nayopayam Kashayam from the starting itself, I think it will give some result. And the use of Sarpagantha, maybe use of Sarpagantha she is asking for. Uh, I'm not sure whether it causes any problem, but so many of the antihypertensive drugs in the modern medicine, if that adverse effect is also can be expected from here also. So I think the Sarpagantha can be used, and the Ovarilla, that Amshumati, Sthira, is another option of using that Brihat Nayopayam Kashayam from our Vaidaratnam is having that combination. That has to be, and all the pathyas, what advised for pathyas is the main thing. With the medicine only, with medicine only we can't treat the patient, only with pathyas.
Thank you, ma'am. Now I invite Dr. Asha ST, Professor and HOD, Department of Suti Tantra and Yoga, Government Ayurveda College, Kannur, to express our sincere thanks, Dr. Rajita Arvaria, for such a valuable session.
Thank you, Dr. Rajita, for spending your valuable time with us. You have covered almost all the disorders of pregnancy in a concise yet orderly manner with case scenarios. That was actually very, very interesting. And you have shared some simple Aushadha yoga for management also. And that seems very much informative for the practitioners. And on behalf of all the faculties of Department of Prasuti Tantra and Stri Roga, Government Ayurveda College, Kannur, and all the delegates, I express my sincere gratitude for your informative talk. Thank you.
Thank you, ma'am. Dear delegates, here we end the first day of JEEVADA 2024. Hope you all had a fruitful afternoon with our department. The program will be continued, and the next session will start at sharp 2 p.m. tomorrow. Thank you. Thank you all.